Hi, I'm Natalie Vargas. The following video is my Girl Scout Gold Award project I have been working on for quite some time. In this video, I will be raising awareness for von Willebrand disease for daycare providers. Due to COVID and these times, unfortunately, I will not be able to go in person and educate and share this project. I kindly ask you to share this video with your friends and family to spread awareness about von Willebrand disease. Thank you and enjoy.
Hey guys, I'm Natalie Vargas. Do you know what VWD is? Well, VWD stands for von Willebrand disease. Do you know that von Willebrand disease is the most common unknown bleeding disorder in the United States that affects up to 1 to 2% of the population? Did you know that there are types of VWD? The types are based off of the different severities. I have type 3 personally, and I'm here to tell you more. I bet half of you don't even know what I'm talking about. Well, I'm here to raise awareness about a specific type of VWD, type 1. The symptoms of type 1 can often lead to speculations of child abuse in younger children. I'm here to talk to you, the child care worker, what you should look out for and what to expect with a child with VWD type 1. So what exactly is VWD? Let's hear from the doctor himself, Jonathan Bernstein from Connecticut.
I'm a pediatric hematologist oncologist. So basically what happens is there are multiple phases of forming a blood clot. So if you get bruised up, what ends up happening is you get little holes or tears inside blood vessels. The blood starts to leak out, and von Willebrand's factor, which is one of the causes, basically attaches to the collagen, grabs a hold of platelets as they're exiting the blood vessel, and basically form a platelet plug, which slows the bleeding or stops the bleeding temporarily, that the rest of the clotting mechanism can catch up and basically form a good blood clot over the wound and allow it to heal. The most common basically are bruising, nosebleeds, anything that where there can be some tears of the blood vessels. They want to be very careful about certain activities, about how their daycare center is set up if they're going to be taking care of a child that has von Willebrand disease, and know when they need to call mom, dad, and the doc. In those situations, if they don't or they delay, it can cause big problems. I don't expect them to be able to infuse and give the factor over the center, but I do expect them to be able to call someone who can.
Now that we know what VWD is, let's hear from families and their stories.
You know, VWD is a super interesting disease because a lot of the symptoms can happen to any child at any time. Bruising is something that every child gets bruises. I know my kids always have bruises on their legs. It's been totally normal, right? They're kids, they get bruises. But I think what people need to look out for, especially daycare, is how many they're getting. How many nosebleeds are they getting? Is it normal to get more than one in a day? Is it normal to get multiple in a week? Are the bruises maybe a little bigger than normal as opposed to like a small bruise? Just things like that. If you're noticing that the other children don't have as many bruises or other children aren't having these symptoms, it's never a bad thing to go ahead and get it checked out.
Take life as it comes, as it goes. Do what you can, live it the best you can, but have as much in place as you can. I think with whatever you have that is offered to you, just make sure you follow up as much as you can. So you really got to ask a lot of questions. You got to be really prepared for everything. But try not to let it rule your world, your life. Try to live it as best as you can, because you don't know what's going to happen from day to day with any of us.
Again, like my son got a lot of nosebleeds, and the thing about being a parent is you always have that instinct when something isn't right. I always get it checked out. I thought it was really weird that he would get like 5 or 8 nosebleeds in one day. And we were able to get our daughter tested, but something I didn't know before she was tested is a lot of kids get their vaccinations. At the 4-year checkup, my daughter got, I think it was 3 shots at the same time in her hip. She had this giant hematoma. And I mean, it was huge. It was like a baseball. I've never seen something like that. So if something like that happens with your child that's not normal, maybe go ahead and get it checked out. So that's kind of like the one story I guess I think of the most.
Just be patient with them and realize that you don't know what that's going on in their psychological mind. like when there's a bleed, you're gonna have a major episode, like it's gonna be a big old event. And it kind of scares you because when my little boy was born, he was an emergency C-section. So the whole time we knew emergency C-section, that was it. So of course we all freaked out. Luckily, everything went fine. So I'm thankful for medicines that are out there that do stuff, because that was probably the scariest point in my life. A lot of people just think it's minor, and it's really not. It's actually a lot bigger, especially when something major happens.
Thank you guys so much for watching this video. I hope this information gives you, the watcher, a better understanding and knowledge of what VWD is.